was just a photo.
Oh, where are we? Why is it? Oh, okay.
All right.
Yeah. Right.
Sorry.
Why are we not
Should
on?
have said.
Yeah. We were talking about a little known simple component of labia, and we will talk about transaxillary augmentation to cap this morning off. Ding. Live video. There he is.
Okay.
And starting live video. Okay. There we
This
go.
has been going for a while, but
Mhm.
that's okay.
All right. We're on.
Good morning, folks. This is Dr. Thomas Bartell, board-certified plastic surgeon and specialist in body recontouring surgery, operating out of here of Madison, Wisconsin. And this morning I wanted to talk about probably a little sensitive subject. It's a lesser-known procedure that I've been doing for several years now. It's not something that a lot of women are aware of or need to have or want to have. But for those who this is an issue for, it's really an important issue. And this is an operation that's called a labiaplasty. Now, some sites will label this as vaginal recontouring or rejuvenation. What is really we're talking about is reducing the size of the labia minora. Now, those are the two little flaps of tissue, little triangular flaps of tissue that hang down from the genital area on a woman. And this is a area that has a wide variety of anatomical differences from woman to woman. Some women, their labia minora are relatively small and aren't a problem, but for some, the labia minora hang quite low and are very relatively large and can cause physical symptoms. Pinching. It can cause them to be uncomfortable when they're, for instance, riding a bicycle or even just sitting in a desk chair. And certainly during the act of sex, it can be very, very uncomfortable. And in this day and age, when we have the internet and anyone can see just about anything on the internet, women are able to compare their own anatomy with those of, countless other women, and see the differences, and they might feel a little bit uncomfortable with the way they look. So there is this operation that's called a labiaplasty that reduces the size of the labia minora. Now, there are a couple of different techniques that have been described over the years. Initially, there was simply a very crude technique of amputating the end of the triangular segments and putting some stitches in and so forth. There's now a more elegant technique that's called the alter wedge labiaplasty, named after a surgeon named Gary Alter. And it's certainly a lot more elegant. It takes a wedge out of the end of the tip of the labia minora and realigns it so you get a better contour, a better color match, skin match, and so forth. And it's more predictable. Obviously, if not enough tissue is taken out, you're not accomplishing your goal, and if you take too much out, things can get too tight. Because I tell my patients, this is a part of you that's meant to be used. So, you need to be careful about how much is taken out. I've been doing this technique now for 4 or 5 years. It's very predictable. It's a relatively simple thing to do. Now, I do this under general anesthesia. Not every doctor does it that way, but I can't imagine any woman wants someone coming at them with a big needle and local anesthetic in that area. So we do this under a short general anesthetic. Post-operative, the surgery itself takes perhaps an hour, another half hour in the recovery room, and then, of course, someone else drives you home because we work in an accredited facility. Post-operatively, there's not a lot of downtime with this one. It's similar to how an obstetrician would treat one of their patients who had delivered a baby. You just kind of keep things clean, put a pad down there. The only restrictions that I ask is that women not use any tampons and refrain from sex for about 4 weeks to prevent my suture line from getting disrupted. But after that, these women are some of the happiest patients I have, because, I mean, they were suffering with this problem, you know, either from a cosmetic standpoint or a functional standpoint. And it's such a simple thing to do, and there are not a lot of surgeons who do this. You know, the reason I first got into this was because I kept getting a steady stream of patients who would come in to my consult room and would ask me, do I do the procedure? And I said, no, I really don't. They say, well, who does? I say, I have no idea. And it's hard to find someone who will do this for you. But I've been doing it now fairly regularly now for, say, 4 or 5 years, and it gives a lot of patient satisfaction. So if this is something that you've been struggling with, this is, you know, you're not alone. there are a fair number of women who share your problem. So come in and we'll talk about it. And I have plenty of before and after pictures that I can show you. I can describe the technique in more detail. So don't feel ashamed of coming in and just chatting about it. So anyway, that's enough on labiaplasty. The other thing I want to talk about again this morning, and I say again because I've talked about this in the past, is the transaxillary breast augmentation that I perform. This is a technique of doing breast augmentation with leaving absolutely no scars at all on the chest. In fact, even the scars that I leave, which are up in on the armpit, I put that incision in a thin little skin crease that you already have, so that 6 or 8 months after surgery, I can't even find the scar. So you can have your arms up with your little bikini top on and no one knows I was ever there. Now, not everyone performs this technique. We live here in Madison, Wisconsin. There are several plastic surgeons who will do a breast augmentation for you, but they will all put a permanent scar on you under the breast or around the areola or so forth. Some of them may claim that they can do a transaxillary or through the armpit breast augmentation. They may even have it on their website, and I've seen this. But if you go and actually have a consult with these doctors, they will always tell you, no, I don't either do that procedure, or I don't do it anymore, or you're not a good candidate for that. And I know this because I had a patient here in my office this week who had been to see 3 other plastic surgeons in town and asked for the transaxillary breast augmentation and had been turned down all 3 times, saying, no, the doctor doesn't do that technique. Well, okay. So, while I really can't legally say I'm the only one who does it here in town, I have yet to find a single patient from one of the other doctors who's had it done by the transaxillary approach. I haven't seen it. I'd love to hear if anyone's out there who knows someone, I would love to hear about it. But as far as I know, my personal impression is I'm the only one who does it. I can't legally say that, but if you want to have a breast augmentation done through the armpits, you know where to come and you know where not to go. So that's it basically for today. I hope everyone's staying warm and staying safe. Our thoughts are with the folks down in Florida, that terrible shooting down there. I'm not going to get into politics, but you know, as a physician and as a father, I feel our thoughts should be with them. We'll see you next week. Take care.